Hello everyone. Today's topic is balance and equilibrium, which are essential for independent mobility and fall prevention. Balance is not automatic, it is highly a complex neurological process. So, what is balance? Balance is the ability to maintain the center of gravity within the base of support. So, it depends on vision, vestibular system, proprioception, central nervous system, musculoskeletal response. So, any failure in any system leads to instability of the balance. Yeah. So causes of imbalance, what it could be? So the first common causes include aging, stroke, Parkinson disease, vestibular disease or disorders, neuropathy, arthritis, and medications. So understanding the cause helps us to design the targeted interventions. Yeah, medical conditions that is affecting the balance and mobility is, as I told before, it is nothing but the neuropathies, arthritis, in which neuropathies, the peripheral damages, whereas the patient even couldn't feel about the any sensation in the limb, and they'll be placing their limb somewhere, they might got injured and they might have a fall or imbalance might happen. So whereas in arthritis, in which the patient will be experiencing a joint pain and inflammation, and consequences of it leads to limited range of motion, so that the balance has been missed in such conditions. Whereas in cardiovascular issues, most common issue is orthostatic hypertension, in which the patient will be experiencing sudden sort of giddiness immediately after getting out of the bed, in which the patient will be missing the balance and imbalance will be happening. And the other thing is visual impairment. As we all know, age is happening. Visual impairments might also be a major cause for any imbalance that is happening. So assessment, coming to the clinical assessment, so balance evaluation includes, the first thing is detailed history of falls, in case of any previous falls is being noted, or the frequency of the falls and the time that the fall is occurring, whether it is nocturnal or daytime. Every detail of fall history is being collected in order to rule out the causes. For example, in which in Parkinson disease, the forward fall will be happening, that is the patient will be falling really forward, whereas in posterior supranuclear palsy conditions, the patient will be falling backward. So depending upon the fall also, we could also come to the conclusion of which kind of disease the patient is being affected. So the detailed history of falls is strongly recommended. The second thing is the posture and gait analysis, that is physical examination, assessing posture, gait, strength, and range of motion, in which the patient is patient's ability for balance is being assessed. The third thing is Berg balance scale. So as we all know, we have scales for everything to assess something. So in balance, we'll be using Berg balance scale to assess the patient's balance ability or capability. Whereas the other thing is also timed up and go test, that is tuck test, in which we'll be insisting the patient to sit in a chair and to get up without using the proximal muscles, and we'll be asking the patient to go to reach somewhere and then coming back to the place in which they have been seated. So this is nothing but timed up and go test. Whereas the last thing is a Romberg's test. Romberg's is nothing but in which the patient will be instructing to stand with closed eyes. So in case of any imbalance happening, the patient won't be able to stand as such. So the patient will be moving and swaying to and fro or side to side. So the last thing is instrumental analysis. The force plates and motion captures for objective data is being used for to assess the balance in patients. Yeah, the principles of balance training is nothing but a progressive challenge must be given. So gradually increasing the efficacy of the patient is noted, and the specificity and repetition and varied and safe, it must be according to this principle. Balance training is being given. Exercise must challenge the system without risking the force, that is the most important thing. And yeah, training progresses from static balance, dynamic balance, sensory integration, and perturbation training is also being given. This improves the postural control, coordination, and confidence in the patient. Yeah. And coming to the conclusion, balance training is vital for independence and fall prevention. With structured assessment and individualized programs, outcomes improve significantly for the balance